is this going to be an issue that you talk about a lot on the campaign, and do you think it's going to play in November?
Well, it's tough to say. I'm trying to emphasize healthcare as one of my main issues because healthcare is literally a life or death situation. And I think this is one of the biggest misconceptions that we're hearing politicians out there saying, well, free market didn't work. We have to go to socialized medicine. Well, if I could get one message across to every American voter, it's that we do not have a free market system and have not had one since at least World War II. So the free market would actually fix the problem. It's not something we need to fix. And going to a single payer system is just scary. And when they say Medicare for all, I immediately think VA hospital for all, and all of the rewards and punishments again of a monopoly, which again, the left never explains why big corporations are so evil and why monopolies are bad. But monopolies are great when it comes to your healthcare. It seems like that would be too important of an issue. So I do like to talk about the coronavirus in that I get to explain in practical terms, okay, here's how the FDA has messed us up, because the Libertarian Party for decades has been emphasizing the FDA, even though the average person, they don't walk around thinking, I want a politician who can straighten out the FDA. They're not thinking about the FDA. But here's a great example of how I can say, okay, the FDA just affected you. Because the FDA kept testing kits off the market. Those people in South Asia who got tested, they got tested with the kits that you weren't allowed to have because of the FDA.
They did the same thing with N95 masks where they would keep sort of moving the goalpost. And it was sort of I suspect ultimately it became more of an anti-trade thing than a health and safety thing. But there's all sorts of examples from this lockdown. You mentioned one of them, cancer patients foregoing treatments. Pet peeve of mine. It couldn't be more stupid to see governors and I believe the attorney. I keep saying attorney general, but the surgeon general at the federal level. This idea that all of these hospitals should suspend so-called elective procedures, and they lumped cancer treatment, cancer surgery into elective treatments. And I'm like, dude, if you have cancer, that's not elective. And it's the height in arrogance that a politician would have any idea how healthcare markets work, and they didn't imagine the unintended consequences of that.
And that's the worst part, is that a year later, 2 years later, when we see deaths go up, they're going to say, unintended consequences, like anybody with an IQ of 80 couldn't figure that one out.
Yeah, and after the Italians did it, Governor Cuomo decided, this is the most shocking thing to me, he decided to herd recovering COVID patients into nursing homes, which it didn't actually take a rocket scientist to know that was a death trap for those poor individuals. So we do have sort of living, breathing examples of what central planning does when it comes to healthcare, and hopefully we can connect with people, because there is that sort of cognitive disconnection between I hate monopolies and I hate concentrated government power when it comes to policing, but let's do it in healthcare. What could go wrong?
Yeah, exactly. I'll tell you what can go wrong. You can look over at the UK, which gives bonuses to doctors for not sending their patients to specialists.